Our GMA cover story, actress Ashley Park revealing that she was hospitalized and in the ICU for critical septic shock. The Emily in Paris star wrote about the health scare on an Instagram post, saying that the condition spiraled from a case of tonsillitis and that she is now on the other side of it, thank goodness. ABC News medical correspondent Dr. Darian Sutton joins us now with what we need to know there. Good morning again.
Morning.
This is so scary. So break this all down for us, Dr. Darian. What do we know about what happened to her?
It's definitely scary. I'm happy that she's doing better, and I'm so appreciative that she spreads awareness about this diagnosis. More than 1 million people each year are diagnosed with some level of sepsis. And for us as doctors in the hospital, sepsis just simply means your body is responding to an infection. And we look for some signs that can include changes in temperature, heart rate, blood pressure, difficulty breathing, or something that we call signs of organ dysfunction. This is why we sometimes have to repeat that blood work during the hospital stay. And then most importantly, something that we pay attention to, a change in mental status, for example, confusion. Those are some of the signs that we use to identify this patient needs assistance sooner than later.
Now, she is a young woman, seemingly healthy. Yes. We just saw her in the new Mean Girls musical. What symptoms do you need to look out for yourself? You mentioned what doctors look out for. What can you look out for?
Well, I think it's helpful to understand that sepsis can be due to any type of infection, bacterial, viral, fungal, and it can be anywhere, pneumonia, a urinary tract infection, or even something like this, like tonsillitis. But the symptoms can be systemic, where you feel whole body symptoms like dizziness, fatigue, difficulty breathing. But I think to answer your question, the most important is, do you know that you have signs of a specific infection? And that can be a skin infection and so on and so forth. So it's about paying attention to your body.
And we know that this started for her as tonsillitis.
Yes.
How do you know when something is not just a sore throat and you actually need that urgent medical help?
That's a great question. And patients often come in with a sore throat, but I think I'm, number one, asking how long have you had this sore throat? A sore throat longer than 4 or 5 days, I'm beginning to increase in my concern. Also, some red flag symptoms. Are you having difficulty breathing, difficulty swallowing? Are there changes to your voice? Do you feel like you have a muffled voice? These are all signs and symptoms that we qualify as red flags and need intervention quickly.
And this can happen at any age?
At any age, yep. So it's always important to pay attention to your body.
Really important conversation. Thank you, Dr. Darian.
Of course.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.